In addition, vitamin C is required during all of the following except option A infancy, option B young adulthood, option C childhood, option D pregnancy. The answer is option B young adulthood. Additional vitamin C is needed in growth period such as infancy and childhood and during pregnancy to supply demand for fetal growth and maternal tissues. Young adulthood requiring extra vitamin C include wound healing, fever, infection and stress. A prescribed amount of oxygen is needed for a patient with COPD to prevent option A cardiac arrest related to intracranial pressure of carbon dioxide in the arterial blood, option B circulatory overload due to hypervolemia, option C respiratory excitement, option D inhibition of respiratory hypoxic stimulus. The answer is option D inhibition of respiratory hypoxic stimulus. Delivery of more than 2 liters of oxygen per minute to a patient with chronic obstructive pulmonary disease who is usually in a state of compensated respiratory acidosis due to retained carbon dioxide can inhibit the hypoxic stimulus for respiration. To assess the kidney function of a patient with an Foley's catheter, the nurse measures his hourly urine output. The nurse should notify the physician if the urine output is option A less than 30 ml per hour, option B 64 ml in 2 hours, option C 90 ml in 3 hours, option D 125 ml in 4 hours. The answer is option A less than 30 ml per hour. A urine output of less than 30 ml per hour indicate hypovolemia or oliguria, which is related to kidney function and inadequate fluid intake. The most common psychogenic disorder among elderly person is option A depression, option B sleep disturbances, option C inability to concentrate, option D decreased appetite. The answer is option A depression. The most common psychogenic disorder among elderly person is depression. Sleep disturbances, inability to concentrate and decreased appetite are symptoms of depression. Other symptoms include diminished memory, apathy, disinterest in appearance, withdrawal, and irritability. Depression typically begins before the onset of old age and usually is caused by psychosocial, genetic, or biochemical factors. The most common injury among elderly person is option A atherosclerotic changes in the blood vessels, option B increased incidence of gallbladder disease, option C urinary tract infection, option D hip fracture. The answer is option D hip fracture. Hip fracture is the most common injury among elderly person, usually result from osteoporosis. After 1 week of hospitalization, a 65-year-old patient developed hypokalemia. Which of the following is the most significant symptom of his disorder? Option A lethargy, option B increased pulse rate and blood pressure, option C muscle weakness, option D muscle irritability. The answer is option C muscle weakness. Symptoms of hypokalemia include muscle weakness, chronic fatigue and cardiac dysrhythmia. The most common deficiency seen in alcoholics is option A thiamine, option B riboflavin, option C pyridoxine, option D pantothenic acid. The answer is option A thiamine. Chronic alcoholism commonly results in thiamine deficiency. The patient about to undergo abdominal inspection is best placed in which of the following positions? Option A prone position, option B Trendelenburg position, option C supine position, option D sideline position. The answer is option C supine position. A patient is kept off food and fluid for 10 hours before surgery. His oral temperature at 8 am is 99.8 Fahrenheit. The temperature reading probably indicate option A infection, option B hypothermia, option C anxiety, option D dehydration. The answer is option D dehydration. A slightly elevated temperature in the immediate preoperative or postoperative period may result from lack of fluid before surgery rather than from infection. Anxiety will not cause an elevated temperature. Hypothermia is abnormally low body temperature.